let's get to Dr. Don Vinh. He's joining us on the line, of course. MUHC infectious disease specialist and medical microbiologist. He's also a clinician-scientist at the Research Institute of the MUHC. Dr. Vinh, thanks so much for coming on the show.
Good morning, Elias.
So, Premier Legault announcing yesterday the 8 p.m. curfew starting on Saturday. Non-essential businesses closed for another month. But there's pickup, by the way. There's the curbside pickup. Slight changes on the elementary and high school side. Masks for the high schoolers, by the way, being provided as well. I'd love to know your thoughts here. What you heard yesterday, do you think it's enough to get us back in the right direction case-wise?
I'm going to be honest with you. I was actually a little bit confused during that press conference. There were some incremental, recommendations for some activities. I'm not sure how much of an impact they have. And of course, the largest, measure, the new measure, but the curfew was also announced. I think the concern here is people are focusing on the curfew in itself. There was even a question by one of the journalists, is there any evidence that a curfew works? So I think we need to make sure we understand specific terms here, right? Because both lockdown and curfew, they refer to the restriction of movement of individuals. And when we say, more specifically, when we say the word lockdown, that means that people are prevented from moving in and out of a region, whereas when we say the curfew, that refers to preventing movement of people between this time and that time. Now, when you look, right, at the effectiveness of these measures, usually when curfews are implemented, at least for COVID, okay, so when curfews are implemented for COVID, they're part of a lockdown plan along with closures, which have been, somewhat announced, and collectively those are effective. In fact, they're quite effective. They bring down the rate of transmission in the community by 40 to 60% when it's been studied over the last year, and they decrease the rate of hospitalization by about 50% within about 2 weeks of a true lockdown with curfew and closures. So if this can be done effectively at the public health level measure, then we will be able to protect our healthcare surge capacity.
So that to me, Dr. Vinh, does sound encouraging. The numbers you just referenced about how it does show to be effective, right? A curfew is effective in other regions that have done it.
It's effective in regions where the public has adhered or complied to it. I have to be honest with you that, in some countries, if you look, there's some almost draconian measures, right? Like in India, there's actually public caning of people who are out and about and violating public health measures. Obviously, I'm not recommending, we go to that extreme, but we also have seen that there have been lackadaisical, adherence or compliance with public health measures in our own city. And so, you can have all the measures that you want or that are either recommended or decreed, but if the public doesn't adhere to it 100%, then they're not going to be effective.
Well, you heard it here first. Dr. Don Vinh does not condone caning. I'm happy to hear that, Dr. Vinh. Yesterday, the thing that stuck out at me was the focus when they were asked, hey, you're not shutting down manufacturing, all this. Why are you not shutting this down? They kept focusing on the people over 65, right? And they said that 80-20 rule, right? So 80% of the hospitalizations are coming from the 20% of the population over in a certain age group, right?
Right.
So with that in mind, when you look at the situation at the MUHC, is that your concern as well, that 80% of hospitalizations are of the elderly and there should be targeted measures for that group?
Yes, so absolutely right. So the majority of people who are hospitalized with COVID are certainly in the 65 and up group. Let's not conflate that idea, though, that just because you're not 65 doesn't mean you're absolutely not protected from COVID. That's absolutely not true. We see people very much in the adult at 20 to 65 year age group, and even children have been sick with COVID. Obviously, not to the same degree as elderly. But you have to remember that the elderly are getting sick not necessarily because of what's going on among the elderly, but because of what's going on among the age group of 20 to 65, right? The 20 to 65 age group accounts for about 60% of confirmed cases in the community. And that does not stay in the 20 to 65 age group. That spills over. That spills over to both the less than, the child age group, the less than 19, and also the elderly age group, the 65 and plus. So we can't live in these silos that says, okay, well, it only affects the elderly, so we don't need to do anything. We need, as a society, to play our role so that all members of society are protected.
When you look at the curfew that comes into place on Saturday, how much time do we have to give it, Dr. Vinh, before we can really say it's working?
The curfew, I think we have to not get too focused on the curfew itself, because the curfew itself, we don't know if you had a curfew with no other measures that you were adhered to, we don't know how effective that'll be. Mm-hmm. The curfew is part of a recipe, right? It's an ingredient. You need to have the curfew along with, and of course, compliance with the curfew and compliance with the other measures, right? The closures, the restriction of social activities, all of those things, so that we'll know it's effective. There's a lot of people with the measures that have already been in place that people are trying to find loopholes and gray zones where they can, justify to themselves their actions, either traveling abroad or aggregating in groups. And so if that's the mentality of the public, then the public health measures are not going to be effective.
All right. Dr. Vinh, as we end off here, I want to ask you about the situation at the MUHC. And what can you tell our listeners about the situation in MUHC hospitals and the capacity situation?
So, as was mentioned around the Christmas time period, the MUHC adult ICU units were threatened, right, in terms of the number of patients, but particularly the number of patients with COVID, to the point where some of the patients in the ICU had to be actually transferred to the children's ICU so that they can get their care there. So you can imagine, that's not the ideal situation, but when push comes to shove, that's how we adapt, but we don't want to be in those situations. That's not unique to the MUHC. Unfortunately, there's hospitals all across the province where the ICU capacity is threatened. The hospitalization, the number of beds are threatened. So that means that other kinds of care, like kidney surgeries that was announced yesterday by Minister Legault, are now, delayed. Other kinds of therapies for other conditions are delayed. And again, this is not the ideal situation. So people have to understand that there are real consequences inside the walls of our hospital that are actually threatening our healthcare capacity. And people may not know about it in the public. That's fine. But trust us when we tell you that things are not looking good.
Dr. Don Vinh, MUHC infectious disease specialist, all-around good guy, not in favor of canning. I love him. He's great. Thanks so much, Dr. Vinh.
Thank you, Elias.